We have a very exciting session planned for you today.
So ladies and gentlemen, boys and girls, hold your breath. We are going to have a very exciting session and we are soon going to start that.
And Rajesh, why do you think this session is so exciting?
Well, this session is going to be too exciting. Why? Because we have come to AIOC for science, but this includes science and fun as well, which is integral part of our life. And that is what we are for. So that is what we are going to have in this unique game show, and that is called Science and Fun in Ophthalmology.
You see, let me brief you. Can we have some silence, please, because you will not enjoy otherwise. You see, genesis of this session. You have had various quiz sessions in the session in the AIOC, but this session is slightly different. Here, the audience participation is also there, and each of the member of audience, please wear the T-shirt, because mere having a T-shirt is not enough. If you don't wear a T-shirt, you will not get 30,000 rupees or 10,000 rupees or whatever. And the cash prize is immediate. Immediately will be given.
So you all are requested to please wear the T-shirt in order to win exciting prizes.
Because the reason, Rajesh, is each T-shirt has a number, small number on the left side. So I will request you to wear that T-shirt. And believe me, the T-shirts are reasonably high quality T-shirts.
This T-shirt is for you. You can take it along with you. You can win prizes with this. So many things with this T-shirt. So this is a magical T-shirt, ladies and gentlemen. Please wear it.
Because
you will.
All the T-shirts are numbered. All the T-shirts are numbered, and we have the counter. Hello. We have the counter numbers here. Suppose I pick up this number. Suppose I pick up this number. This is just a demo. 45. Somebody who has 45 will come to the stage and get a cash prize of 5,000, 10,000, 20,000, 30,000. So people who are not wearing T-shirt will not get it.
So
जैसे भी पहनना तो पड़ेगा. अगर पैसा
so this T-shirt is not for judges and a participant. It is only for the audience.
Only for the audience.
yeah. Hello. The judges.
May I request everybody to maintain silence and sit down. We will start in few moments now. Few moments.
Everybody gets prizes. What about the judges?
Judges will also get. Judges will also get.
ये लो, अरे वो ये ट्रैक जो बज रहा थोड़ा तेज बजवा दो.
Can we have silence?
पूरन तो ये जो बजा रहा है ये पूरन का लेवल खोल दे.
We are starting now.
Please sit down. You will enjoy more. Please sit down. T-shirts आप जाके दे दो. यहाँ पे भेंडे लगाओ. हेलो, क्या कर रहे हो आप? So Ikeda, let's the show start now. Start the show.
Rahil, are you all
Please
set?
wear the. You have got the T-shirt or not?
We are all
They're coming.
set.
They're coming.
Let the show begin.
Let the show begin, please.
So, ladies and gentlemen, the show is about to begin. Please wear your T-shirt within 30 seconds. No T-shirt?
आगे जाओ.
So we hope this is going to be a very exciting and enriching session for you all.
So audio visual people, can we have the promo video?
Can we have the caller mics as well, please?
प्रोमो वीडियो कौन सा है?
Can Ikeda just start?
Audio visual good. Okay. So, ladies and gentlemen, take a T-shirt, wear it fast. You have 30 seconds with you. Yeah. So can we have silence, please? We are now going to start the show. Ladies and gentlemen, I am Dr. Rajesh Sinha, your host.
Everybody clap for Rajesh Sinha. Rajesh Sinha.
With me is...
I am Dr. Ikeda, your co-host for the morning session. And now we'd like to invite our main anchors on the stage.
Well, I would like to invite the mastermind behind the show. Ladies and gentlemen, please put your hands together for Dr. Harbansh Lal.
I think to be successful in a life, we need to have a great skill. We need to So we need to have a great skill, whether it's a surgical skill, medical skill, or practical.
So besides the skill to have really achieved a great success, we also need some amount of luck. So this game was devised keeping that in mind, that you need to be intelligent, you need to be skillful, but at the same time, if luck favors you, only then you can really go very high. So this game is about that. Now I invite Dr. Lalit to say a few words over here, who is our president. Lalit.
Thank you, Harbansh. You see, this show is different from the others. Please sit down, you will enjoy. You see, as was being told, in... Arey, बैठ जाएं, please. So we will have 4 teams here. We will have 4 teams, red, green, yellow and blue. Rajesh, can you please introduce the teams and get them here?
First of all, we would like to call upon the judges. Can we have the team?
Judges.
Can we have Dr. Chandrakant Shettiya here on the dais?
Yes.
Ladies and gentlemen,
welcome.
Give a big round for Dr. Chandrakant Shettiya. We would like to congratulate him. He has become the member of Legislative Assembly of Goa.
3 cheers.
Next, we would like to call upon Dr. Ambarish Darak, who is the director of Vision Next Foundation, Pune.
3 cheers for Ambarish Darak.
Next, we would like to call upon Dr. Ravindranath, who is the director of Drishti Eye Specialty Hospital at Davangere, Karnataka.
We lovingly call him HMR.
And last but not the least, we have Dr. Muhammad Saif from Vellore Eye Institute.
So you see, we have judges from all the parts of the country, and we expect these judges will deliver justice. So let me assure you, यहाँ तारीख किसी को नहीं मिलेगी. Justice will be done here, and we have these 4 judges here who will do justice right here only. Yes, next.
So, ladies and gentlemen, now we would like to call upon the teams. First of all, I would like to call
Before
upon...
you call on teams, let me call the man behind the show. Nitesh, can you please come here for 1 second, if you have time? 3 cheers for Nitesh. He is the man behind the show. Because without him, show would not have been possible. Nitesh, one word.
Thank you, sir. Thank you so much for giving me this opportunity. And I always look for this kind of participation where we are going to learn with fun. Thank you, sir.
Thank you, Nitesh.
That's wonderful. We all thank you, Mr. Nitesh Pandey, for this wonderful work that you have done. And now we would like to request the audiovisual team to start the intro video.
So, so we have 4 teams, starting with blue, red, green, yellow. So I'll call the captain. Srini, can you please come with your team and say, ask for some wishes or luck or 30 seconds.
Hey, wow. Hey, we are Team Blue. Hi. Some. Okay, and we invite you for the next AIOC 2023 at Kochi. We'll be great hosts. Support us now.
Okay. Let's have captain of team. Yeah.
Come.
We are Team Green. Thank you for the opportunity, and all will say, "Go Green! Go Green! Go Green!"
Everybody's with you. Don't worry. So we have team yellow now.
We are Team Yellow. Yeah. We are Team Yellow, and we have
Is
just
this Team Yellow or Team Mango?
Team Yellow is Mango, and we have just one word: whistle podu. We are going to rock today at Science and Fun. Get your whistles ready. Yeah.
Woo. Team red.
Please.
Now, team red.
Team red is from Boss. Yes. Women ophthalmology.
So I think it automatically says we are really high end because we are all women here, so women can cheer. Red is the best. Red is the best.
Just tell us the rules.
Good looking team.
Rules of the team. Rules.
So,
We'll call it science and glamour instead of science and fun.
so before we begin, let's go over the rules. So we have 4 teams which will compete with each other. We have 4 participants in each team. We are going to have 3 very exciting rounds. First, we will have team red, green, blue and yellow in that order present to us. The first round is the surgical skill round, where one of the team members is going to showcase their surgical video for a duration of maximum 4 minutes.
Did you see the prize amount? Just go back. You see the prize amount based on science, based on luck. It's going up to 60,000 rupees in cash right here now.
Woo! And then we will have the second round, which is the medical management round. And they will showcase one very exciting, challenging case that they have come across for a maximum duration of 3 minutes. And then last but not the least, we'll have a rapid fire quiz round. Now the twist in this game is that every time somebody presents and showcases their skill to us, we are going to add an element of luck to those marks. So they're going to come and roll the dice here, and the score of their skill and the luck combined together is going to be calculated in the end. So wish them all the very best of luck.
And Nikita, the participants are definitely going to have a lot of fun, but the audience is also going to have a lot of fun.
What is
lot of prizes, lot of cash
Lot of
prizes.
audience prizes.
Just look at your sleeve. There's a number written on the sleeve, and we have similar number.
46. So if I pick up here 46, you gain 10,000 rupees here.
No. So the prizes for the audience are after every round of presentation, one team presents, there will be 2 lucky draw, and that prize is 5,000. After the 4th team, the lucky draw will be of 30,000, 20,000, 10,000. That means first will be getting 10,000, second will be getting 20,000, and the luckiest person is going to get 30,000 from the audience. And the prizes for the team is, that will be cash prize, nothing. Straight away you'll get it over here. And for the team, the one who is the ultimate winner of science and fun both gets 80,000 rupees, and the second runner-up will get 60,000. Science alone will get 60,000 as a top team, and runner will get 40,000. So if you are lucky, you can get both the prizes at the same time.
Rajesh, can you show what is luck? What do you mean by luck? What do you mean by luck?
Well,
so in
luck
part, what Rajesh is going to do is they will show snake and ladder or Saap Seedi wala game. So the person who has just finished his case, he will roll a dice. If he is lucky, he will get a ladder and climb up. Or if he is unlucky, the snake will bite and come down. So like Harbansh was saying, in life, not only you have to be good, but you have to be lucky also.
Yes, that's about life. You get success by your hard work as well as your luck. So let's start the game show, Science and Fun in Ophthalmology. So ladies and gentlemen, I would like to call upon the first team on the dais, Team Red.
A little more cheer, please. Woo.
That's it.
So Team Red Surgery, you are presenting? Okay.
Hearty welcome to the 3 roses. Welcome, madam.
Before we begin, we have Dr. Rahil Chaudhary here, who has provided us with technical support and is going to help us with the software and the luck part of this game. So please welcome Dr. Rahil Chaudhary.
The entire software has been done by Rahil. Rahil is a master refractive surgeon in Delhi, and one of the highest volume in a day. How many surgeries you do? So 100 refractive surgery in one day. And Contura, he has taken Contura by storm. Anything you want to say? So let's start the game. Okay. So red team surgery. So your time, somebody has to keep the time.
And the judges, please watch the video. You have to score.
The skin to anchor.
Rolled on the dash. Whatever is the average of the 4 judges, will move the dash recording.
Yes, ma'am. So 4 minutes start now.
Skin to anchor. It was a lovely.
So it is not visible.
Madam, Namrata madam, we are the judges.
Surgery.
Least uncorruptible.
Surgery.
Madam, in my humble opinion, I am also a young
The
ophthalmologist.
skin to anchor.
Definition of Namrata Sharma, definition of young has changed.
Boy with a
There is
history
nothing
of
like,
road traffic accident 2 months back presented with the complaints of gradual progressive painless diminution of vision. On ocular examination, we found that the patient had traumatic cataract
Silence.
along with iridodialysis. I was in a dilemma which technique of iridodialysis repair to adopt. When I searched literature, I found multiple complex techniques of repairing iridodialysis. I found Meckelin suture technique to be simple and easy to perform. Since it was a large iridodialysis, we thought of going for 2 passes of Meckelin suture. So for that we needed 2 scleral pockets, but we thought of going for a single scleral pocket from 4 to 7 o'clock. After this, we managed cataract. The capsule was stained with trypan blue, and capsulorhexis was attempted using hidden capsulotome. Since the capsule was calcified, anterior capsulorhexis could not be completed, and we thought of completing capsulectomy with 1 hour Caesar. So, AC entry with a keratome was done, and capsulorhexis completed with 1 hour Caesar. The lens matter was soft, so it was aspirated using Simcoe cannula. A foldable posterior chamber IOL was implanted. For eye dialysis repair, the pilocarpine was instilled to constrict the pupil. 11-proline suture with 2 straight needles was used for repairing iridodialysis. 1 straight needle was passed through the root of the iris and brought out with a railroad technique using 26 gauge needle. The second straight needle was passed in the similar fashion through the root of the iris and brought out using 26 gauge needle. What we observed was that with the single pass of Macallan suture, the pupil was circular and there was no need for going for second Macallan suture. The patient had a circular pupil with an excellent post-operative outcome.
That was.
Please give the marks.
So let's have the marks by the judges. Marks.
7, 6.
4 judges.
7, 8. So 7 is the average. Move the dice by 7.
Ma'am, can you come here? Try your luck now. Science you have presented. You have been marks. 7 marks. Now come here and
snake and ladder.
try your luck.
7
Snake
itself
and
is a
ladder on
lucky
this
number.
case.
1 second. 1 second.
Just let it. And if by chance you get a 6, you will get another chance. Like true snake and ladder.
Wish me luck. Wish me luck.
Yes. But so the score she has got is
7.
4.
This is
4.
ये स्क्रीन थोड़ा इसको छोटा कर दो.
Can you reduce the screen size? थोड़ा screen छोटा कर.
Seven plus 4, it becomes 11. Now you call the second presenter of yours. Yeah, I नहीं ऊपर आता था. थोड़ा सा screen छोटा कर दो.
Can we have the medical case now from the team red?
So madam has scored total of 7 plus 4. So you can have a seat.
अब क्या करना है? तुम वैसे बोल दो उसको कैसे याद.
Next person is the medical round by team red.
आपने बोल दो.
Red team.
First round they have got 11. So
the surgical
so
round
one is that
through and 11 points for
yes.
the red team. Okay. And now the medical.
Yeah, medical. You want to present some case on the? Actually, unfortunately, one of the participant is just stuck outside. They are not letting get her in because she is coming from the airport and she could not get her registration card.
Sir, life is a matter of luck. Getting caught in traffic jam is also considered.
Absolutely. Sahi, absolute, very valid point you have made. So this is also luck. So today, luck is not favoring. Okay.
So I have the case. I'll present.
Yeah, present. Go ahead.
But you can overcome unluckiness with hard work. So go ahead, madam.
Can we have the screen?
Screen. PowerPoint, yeah.
So this is a case of a recalcitrant scleritis. A 45-year-old female presented with complaints of ocular pain, redness.
3 minutes.
Shout.
In right eye since 5 days, there was no history of joint pain. Rest ocular examination was normal except for the right eye scleritis. On first presentation, we started with the systemic NSAIDs and loteprednol along with other supportive treatment. But within 7 days of treatment, there was no response, so loteprednol was shifted to prednisolone. After 7 days, there was no response and we added systemic prednisolone along with other systemic investigations which came out to be normal. However, after 5 days, the patient presented with an increase in intraocular pressure, and for this, anti-glaucoma medication was added and prednisolone was tapered. However, after 6 days, she came with the complaints of diminution of vision and joint pain. The pressure with AGM had gone down to normal. The congestion had reduced, but there was diminution of vision. We went for an OCT examination and the patient had CSR. So this was a patient who was steroid responder. We took her for rheumatology opinion, who advised her ANA. Steroid were withdrawn. Patient was shifted to methotrexate and with folic acid, and steroid was withheld, and ointment tacrolimus was added with nebafenec and timolol. But patient could not tolerate tacrolimus. You can see the swelling that came on her face, and we were like, what to do? Everything was going in a bad direction. So we withdrew the tacrolimus, added cyclosporine eye drops. She was ANA positive, but the methotrexate, systemic methotrexate did good. The swelling subsided. CSR resolved after 2 months, and after complete 3 months, the eye was quiet, IOP was normal, and all the medicines, eye drops have been withdrawn, and she is in consultation with the rheumatologist. So the take-home message is, make patient understand his problem, counsel patient properly, document each and everything. Whenever you are starting steroid, tell them that it may have these side effects. Close monitoring is needed. We also need to have patience, and a multidisciplinary approach is needed. Thank you.
Sir, in addition to all of these approaches, the patient also needs a little bit of luck to go to the correct ophthalmologist. So on that note, we will give them a 7.
6. So we take it as 7, half is taken as full. So roll the dice by 7.
Come back.
Seven down. 7.
Yes, stop it.
So luck is 2 marks, 7 plus 2, 9. So you move the dice.
Awesome!
No, madam is saying this. How lucky are you now?
I am very unlucky.
Very lucky.
Madam
Very
has
lucky.
overcome the traffic jam. Good.
That's what I say.
Sir, I said it right time. आपने तुरंत ही भगवान से प्रार्थना कर दी.
She is lucky. All done.
Excellent. Madam,
now
you got caught in the traffic jam? Okay.
So that's wonderful. Now we are going to start the quiz for Team Red. Can we have Team Red there on that podium?
can you please come here? All of you come here.
All of you can go there, but only one person can give the final answer, right?
And as you know, in 2 minutes it will stop.
And let's
You can
come to the
prompt,
rules.
But answer will be given by only one
Rajat
person.
sir,
Let's come to the rules for the quiz.
sir, please authorize one person to answer.
Yeah, only
One person to
will
answer,
Let them decide.
others can prompt,
Yes.
but answer will be given by the same person. And at 2 minutes, if you have 5 questions,
I'll
5 maximum is 10.
But you have to
So
answer.
can you audiovisual please, can you connect this laptop? Yes.
Team Red,
So just in very short, the rules, each team has 2 minutes to answer a maximum of 10 questions. All the team members can participate. There's no negative marking. You either answer the question or you can say pass if you don't know the answer. It is not possible to go back to a question later. So think wisely and answer quickly, and all the very best to you.
yes. And
So
Red,
your time starts now. Be focused. Red team, be focused.
Team Red, focus now. Your time starts now. The first question: where is the most likely location for the primary retinal break in this retinal detachment? Your time is ticking.
6.
Okay, so that's a wrong answer.
No, I
It is
think this
C.
question you won't get any marks. Only one person has to speak.
That's a wrong answer. We'll go on to the next question,
please
please.
authorize one person.
Only
The next
one person.
question is: a 15-year-old female presented with blurring of vision, both eyes. Clinical picture was similar in both the eyes. All are true except. Which one is false? You can pass if because you have to answer all the questions into
C.
That's again a wrong answer. It's D. Go to the next question. All of the following effects may be associated with the use of dorzolamide except metallic taste, tingling in the hands, skin rash, optic neuritis, which does not happen with dorzolamide.
D.
Come again?
Last
D.
Okay, that's the correct answer. That's optic neuritis. Next question is: which statement concerning the cornea is false? So which of these is false?
It's too long a question, Rajesh. Very long question.
C.
Well, it's D. Bauman's membrane is not a true basement membrane. The next question is, what's the difference in light sensitivity of rods compared with the cones? Equal, 10 times more sensitive, 1,000 times, 10,000 times. Your time is ticking. No negative marking for wrong answer. You can go ahead.
Pass. C.
Okay, C is the correct answer. That is 1,000 times more sensitive. Next. Okay.
The time is up. 2 minutes are up.
So 2 minutes up. What is the score?
The final score is 2 points by Team Red. Now we can try the luck for them. Hopefully the luck will
Only
be
2
your side.
points. Now you try luck here.
Luck.
Luck. Let's try the luck.
Good. Just
Tap.
tap करना.
So once again, the roll of dice.
So
That's
this may be
not luck.
actually this may be actually winning score. This is quite an high score because you have got stairs twice. I think it's very unusual.
So I must say, red team in science did not perform so well. But science, luck-wise they performed. So लड़कियाँ ही होती हैं कि luck वैसी अच्छी होती है. So now we will have a audience. अरे audience का है, and audience के लिए I'll call upon one of the judge to pick up one.
Don't sing. Just keep your eyes.
Pick up one.
Sir, the Goa MLA should pick up one number.
Pick up one. So now you all of you should see your t-shirt what number. This number I have picked up is 185.
Is there anybody?
185. Anybody?
The t-shirt is still in the bag.
T-shirt लेके जाओ.
Pick up one more. Red team, you can sit down. Second number we have picked up is 49. 49.
No, put on a t-shirt. If you don't have a t-shirt, you
Come here. Run, yaar.
Tambi, your number is 49, not your age. Come fast.
अरे 49 अगर मुझे 5,000 मिले भाग के आ जाऊंगा यार.
And next number is 189.
189. Come, please come. Jump. भाग के आओ. So I'll request our treasurer who handles all the finance of the AIOS. सारा पैसा इसके पास रहता है. So 5,000 rupees.
Rajesh bhai, is this with GST or TDS or is it direct?
TDS deduct. Black money.
Only black money for the
It is black money. Myself, Hardik Patel.
So Rajesh Sinha will hand over a cash prize of 5,000 rupees. 5,000 rupees.
Where are you from, doctor? Number 49. Number 49. Where are you from? Gujarat. These Guju fellows are always lucky.
Another 5,000 rupees goes to madam. Madam, you are from?
Bangalore, sir. Dr. Parvati.
How do you feel getting? Wait. How do you feel getting 5,000 rupees without working hard?
No, this is the first time I got luck. Every time I lose, this is the first time.
You are happy today? What will you do?
Team Green to get ready for video presentation.
Pizza khao.
On stage.
So Rajesh Sinha, our treasurer will hand over this check. 5,000 rupees cash.
Madam, count the 3,000 cross checking.
So this is our young team, AIOC members.
So now we have YOSI team. Youth needs to be encouraged. So you can start.
Can you start the video of Team Green, please?
Team Green, the first video.
Dr. Karan Bhatia.
This is the most well-balanced team, sir. 1 girl, 3 boys. All are going green with jealousy over the girl.
Sai, why are you jealous?
Sir, the girl
You are
is
jealous
mine.
for the girl or what?
I am not jealous. The girl is already mine.
Okay, let's hear. Let's please concentrate. Concentrate on science.
Can you start from the beginning, please? Can you start from the beginning? Before 0, 0. Yeah. Thank you.
Mixing complex insect and specifier. 23-year-old one-eyed post-study who was dependent on others for the simplest of tasks, faced a thick fiber of intestinal membrane or retrocorneal membrane. The question arose, what to do? Should you do a full thickness keratoplasty here or put an endothelial keratoplasty with justice? This is what the case looked like on the operating table. The step 1 was the decision making. For this, a hockey stick knife was used and the epithelium was removed for a better visualization of the anterior chamber structures. Step 2 was the anterior chamber reconstruction. A reverse sensory hook was used to strip this retrocorneal membrane DM complex from the rest of the cornea. One has to be very careful and gentle over here. Anterior synovial lysis was then done using an iris repositor, and this also helps to strip off this membrane.
तुमने वो कर दिया
हाँ 2 है
लो
तो
इसी
मैंने
बेस
लिख
पे
दिया
सेम ग्रीन कर
So strongly attached.
और मेरे पास फोन है मैं आपको टाइमर इसी में दे देती हूँ
Sometimes it gets difficult to separate, so therefore cutting with the scissors really helps. This membrane was then removed using a McPherson forceps, and you can see how thick it is. Peripheral anterior synovial lysis were done. There was multiple iris tags. They need to be cut with a vitrectomy cutter, otherwise they might interfere survival of the endothelial graft. The next step was to square up fixated IOL implantation. A clear corneal incision was made, which was enlarged to 5.2, and using mixed technique, an angle transconjunctival sternotomy was done using a 26 gauge needle, and this needle was brought out of the corneal incision. The needle coding haptic was inserted into the needle lumen, and the iron optic complex was directed into the anterior chamber. The needle haptic complex was brought out of the sclerotic side, a PVC stopper was applied, and similarly it was done on the other side as well. The advantage is the introduction of the haptic into the needle lumen is much easier outside the eye than inside the eye. You can see how centered the eye is. The haptics were trimmed to about 1 millimeter, and the flange was created using a ballpoint heat rod. This flange was currently transparent. Similarly, on the other side, the PVC stopper was removed, the haptic was trimmed, and the flange was again created using this low cost rod. This was also currently transparent. You can see how well centered and stable the eye was. The next step was the decimal stripping endothelial keratoplasty. The interface was attached, as a result of which we had to cut with the scissors. The graft turned out to be extremely thin. However, an ultra-thin dissect graft was put using the push technique. The graft was unfolded using multiple tapping movements in a shallow anterior chamber, and then air was injected to approach this endolenticule to the undersurface of the cornea. Multiple ports were sutured. Post-operatively, you can see on day 21, this patient did extremely well with an uncorrected visual acuity of 6/26. The graft was only 55 microns in size. The IOL is extremely stable. On day 67, the patient's BCVA improved to 6/80+2, and similarly you can see the cornea getting clearer and better. Also you can see on the flanges that are on this side of the screen that are nicely intrasclerally tight. The best part of was this patient became independent and running.
टाइम्ड है ऑलरेडी वीडियो है ना वीडियो ऑलरेडी टाइम्ड है तो इसमें कोई
Sir.
So surgical science.
This is an excellent surgery because the greatest act of luck is to give hope to the hopeless. Therefore, I give them a full 10 for this video.
Karan Bhatia, you have bribed him.
Good.
Luck.
This is what the case looked like on the
Very good, Dr. Karan.
You are already lucky यार ना नौ तो पहले ही हो गया.
Then we'll do our luck.
For this, a hockey stick like this, and the
Hello?
antigen was removed for a better visualization of the antigen.
Yes, try your luck now. Just tap it.
Was the anterior chamber reconstruction. A reverse.
5. Oh, yes.
Awesome! Wow!
So this Karan is known as double luck. पहले भी luck, दोबारा भी सीढ़ी मिल गया.
Now we go on to the second presentation, medical case presentation.
Video there, Aarti. Aarti madam.
Can you please play the video? Started. Volume. No, can you please start from the beginning?
Let's get started.
Is that your boyfriend jumping out of the window?
That's my team, sir.
Ocular surface squamous neoplasia encompasses a wide and varied spectrum of disease. What do we feel when we see such cases in our OP? Treatment options available include surgical excision or medical therapy with mitomycin C or 5-fluorouracil or interferon alpha-2b eye drop or chemoreduction by any of these agents followed by surgical excision. I will be presenting 2 cases of OSSN which were managed by topical interferon alpha-2b eye drops. The concentration for the topical drops of interferon alpha is typically 1 million international unit prepared by mixing the interferon injection with artificial ear eye drops. This 78-year-old male
टाइम अभी है सर 12:48 अभी हमारे पास
since 1 year associated with diminution of vision, pain and body. This patient was put on topical interferon 4 times a day, and this is day 28 picture where the lesion has significantly reduced and treatment is still ongoing. This 77-year-old male presented with complaints of mass in the left eye since 2 months and was started on topical interferon eye drops. On 2 weeks follow-up, the lesion was reduced significantly, and after 3 months, the lesion almost disappeared. This 55-year-old gentleman presented with avascular type of OSSN. Again, topical interferon was started, and within a month, the lesion resolved completely.
This is another interesting case which was misdiagnosed as pingular, responded very well with topical interferon eye drops. So to conclude, I would like to say interferon 2B eye drops can give excellent results for OSSN.
Yes, I.
Very good.
Thank
you.
Excellent video.
Very good.
I'll give a full 9 or rather 9. Sir, 9.
9 ठीक है.
9.
9, 8.
8, 7. Average is 8.
Ocular surface.
Aarti, you can come here.
Encompasses a wide.
So she has got 8 based on interferon only.
What do we feel?
एक interferon के 8 नंबर मिल गए हमें.
Interference by interferon.
Aarti, this boy Zain seems to be a full load of luck.
Get another chance. Yeah.
So green team. So okay, you are actually still behind red. Abhi there are one round to go. One. Yeah.
Quiz is
So
still
let's
there.
start the quiz now.
Luckily, it is tail of the snake, not
Thank
Hold
God
on.
it's the tail of the snake and not the head.
Yeah. No marks for tail.
No.
Tail का कोई number नहीं है. So we'll have the most exciting round now. That's the quiz. 2 minutes.
Sir, tail,
and
you said
T-
no marks for the tail.
No.
Dum का कोई number नहीं, dam का number है.
No, only thing in that, 46 and 52, go back to that, you see. 46, you are at 46, no? So at 52, you have got a snake. So be careful that you don't get those number of marks. 1, 2, 3, 4, 5, 6. So either should be 5 or it should be 7. You should not get 6. If you are 6, make an error by yourself.
Can we have the rapid quiz?
So now we are going to start the quiz.
Timer, 2 minutes. Who will? Kaushik, you will be. So please be quiet. Very important round. Can we have the projection?
All right, all the best. Sorry, we'll restart again. ये ना मुझे ऐसे presentation
This is called luck.
Sir, it was not their fault, so give them that 1 mark, sir.
He answered before actually.
He answered blood drop.
Before the question, they also before the.
Before the question you answered, then something is really wrong.
Before they could read the question.
I think we are dealing with Oceans 4, like Oceans 11.
Go green.
You're very much.
Now you already have the first answer.
Blunt trauma. Next.
We'll move on to the next question. Which of the following findings is most associated with orbital floor fractures?
Enophthalmos.
So this is the wrong answer. Unilateral midfacial sensory loss.
Be slow.
Question 3. A new patient wishes to attend to be fitted with contact lens. The correction is -6 diopter OU. Which lens would you recommend for this patient? Which is the best powered soft contact lens for -6 diopters?
5.8.
That's the correct answer, -5.8. Question 4. Which one of the following is not a protective mechanism against oxidation in the lens?
Vitamin A.
Vitamin A is the correct answer. Question 5. Anti-reflective coatings on glasses and lenses are based on which optical principle?
Interference.
That's the correct answer. Question 6. Which syndrome includes cranial nerve third palsy, contralateral tremor in the extremities and
Benedict's.
contralateral...
Benedict's.
That's the correct answer. Question 7. Please
All of
look
you
at-
cheer for him here.
Which of the following statements is most appropriate for this image here? A single segment is most often used. It is best done.
B.
That's the correct answer again.
Hey, boy.
Question 8.
Good.
Which of the following is least likely to be feature of pelvis?
Central corneal stiffening.
That's the correct answer again.
What?
Question 9.
Time is up.
Viral prodrome.
Give him the benefit.
Viral prodrome, we'll give him that.
Yes.
Big round of applause. Very well done.
Kaushik. What did you have in the breakfast today?
Sir, when I came, the breakfast was not served. That's 8:30.
So I have actually.
He was hungry for the marks over there.
I have never seen 100 or 100 in quiz. So congratulations. Let's see the luck now. Let's see the
You're
luck now.
sharpshooter.
Actually, the score is 7.
The score is 7. The score is 7.
Then you go to the snake's head, I think.
Oh, 6.
One more rolling.
Are you manipulated or what?
No snake.
Congratulations.
So as of now, Yosi team has overtaken. So congratulations, Yosi. You have done very well, all of you. You have been, science also, luck also.
Thank you so much, sir. Thank you so much.
So now we will have the most exciting, that is the audience.
Sir.
So yes, pick up one.
Whoever wins the prize should give me 10%.
So 10% is already, if you agree. The number सुन लो पहले देने से पहले. 79, 7 and 9, 79. अरे पहले से पता उसको.
And next number is 33.
So please, both of you come.
Congratulations.
Both of you come here.
And please, these slips are, we are putting it back. That means on a mega draw you can win again. 10, 20, 30 you can win again. Yeah.
So I will request the treasurer again, Rajesh Sinha, who handles all the money. Rajesh, where is the money today? One by one. So your name, madam?
Dr. Neelam Rathod.
So you are very lucky today.
Yeah, I'm very.
You see 5,000 rupees cash.
That's my
For attending the AIOC, you're getting 5,000.
For attending the session. And thanks Harbansh Lal for conceptualizing this session. Thanks a lot.
Thank you.
Yes, ma'am.
Number
So
33.
women are actually more lucky, you see. As you said.
Sir, a small correction.
Your
Women
name,
are always lucky.
Your name.
Sir, Dr. Shweta Bandopadhyay from Nasik.
So what are you going to do with 5,000 bucks? Don't say I'll give it to my kids.
Sure, sir.
Okay. Thanks a lot and congratulations.
So now the team blue, please come on the stage.
Welcome, Team Blue. The Indian cricket team is also blue.
Great. So now we.
You have already seen what is going on there. The captain has already bribed the judges.
Sir, they have given the
Already,
only to one person.
Srini, already bribed. So,
AIOC from Cochin. I would rather prefer the fish fry.
So now the team blue, you have to do better than Gopal. You do better than the previous team now. Challenge. Challenge. So let's start. Who is doing the surgical round? Video. Dr. Feroz.
Is that a scuba diving glass, madam?
What, sir?
Is that a scuba diving glass because you're from Cochin?
Yes, sir.
Hold on. Let's watch the video.
So it's a PowerPoint, sir. It's a PowerPoint. It's a PowerPoint, sir. No, please put it off here.
Yeah.
No.
लिखा था team blue surgical video.
All right, so can I start, sir?
Yeah,
so
start.
you might have heard of MICS, MIGS. Have you heard of MIOS? Sir, I have a question for you and a cash award. What is the size of a golf ball?
It has 279 pits.
Golf ball size. Anyone? Cash award today. Dr. Lalit is going to give. Size of a golf ball.
2.7 inches.
Green, team green. Intelligent quizzer. 42 millimeters. Alright. So we are going to show you a video where a golf ball size orbital tumor was taken out with micro-invasive orbital surgery, MIOS. Next one, please.
Next one,
So this was a large tumor which was situated in the supratemporal orbit of this 15-year-old girl. And of course, cosmesis is important, and we went ahead doing a lid crease incision where the incision will be hidden in the lid. And this is how we went ahead. No large lateral orbitotomy, no removal of bone, and this is how the steps proceeds. So this is a layer by layer dissection, almost blood free. Going on to the periosteum after the soft tissue incision over here. You can see how the periosteum is clearly seen over here, and that's the monopolar cautery where again we are incising the periosteum. Just a lid crease incision, and that too laterally. Now this is how we elevate the periosteum with the periosteal elevator that I have in my hand. and well up to the lateral orbital rim, the lateral edge. We keep dissecting very gently, and when you actually elevate the periosteum, make sure when you enter the periorbital area that there is no giveaway of the tissue so that the orbital fat doesn't prolapse out. Very gentle, very elegant. Yes, and this is a lid guard, which is a very useful instrument. With that, we actually go inside, separate it up to posterior, and then a small nick in the periorbita, and this is the large tumor, a golf ball sized tumor. Well, a little bit of difficulty in delivering the tumor there. A small nick again in the orbital margin, which is good enough, where it's been punched out. Very gentle delivery of the tumor, like the delivery of a very cute baby. Yes. And yes, you have to be very gentle with the periorbital tissue. You can see I don't use any scissors over here. It's all blunt instruments. No injury to any of the orbital tissue. Very gentle delivery. Delicately separate the tissues. A small nick over here. And then this large tumor was delivered out. As much as tissue has to go inside the orbit, it should not be coming outside. And this is the size of the large orbital tumor over here. You can see it is 42 millimeters. All right, and then you close the periosteum, just the periosteum, and then the soft tissue. This is actually a closure by my resident, a beautiful closure, layer by layer over here. That's the skin closure. Happy to have. No, so this is proline. So inside is 60 vicryl, and for the skin it is 60 proline. And this is done by a resident, okay? Very, very beautiful, the closure, yeah. And this is how it is for a large golf ball sized tumor. Thank you very much. Thank you, team.
Sir,
judges, are you impressed?
Yes, I am impressed. She is one person with a golf ball. That's 1-0, 10.
1-0. 1-0.
Thank you.
Come, Feroz. Come, Feroz.
Yeah, any one of them. Yeah.
You don't believe in your luck? The whole audience is with you. You heard the claps. Feroz, the whole audience is with you.
There is no debate over here, no discussion.
We'll answer that.
So cornea cannot be covered because we always evaluate the pupil while doing the surgery, so that the optic nerve evaluation is so very important.
Good explanation.
So whenever there is a small dilatation of the pupil, it's actually an indication for me to go slow. So that is why it's never covered.
One more. You have to do one.
Oh, one more?
Yeah, we got 6.
One.
Guys, pray.
What a day we are having today. Everybody looks lucky today.
No snake bites today. Yes, sir, no snake bites.
So let's have the medical round for 3 minutes. Gopal, who is presenting?
I am presenting, sir.
Okay. Are you ready?
Let me see, sir.
You see what response of the, what Feroz got, audience response, you have to get better than that.
Yeah. You will do better than that.
Start.
Yeah. So this is a tale of two patients in which we rediscovered the power of an ophthalmologist. Look for subtlest of findings to pick up diseases grossly. So 64-year-old gentleman had decrease of vision in the right eye, painless, gradual, progressive. And on examination, there was a very, very subtle area of graying. There was cataract, and the 6/9 was completely explainable by that. But then there was the subtle lesion here, which on the other side, there was a choroidal atrophy there, the RP atrophy you can see, and probably that sort of an atrophy is developing on the other side as well. But, we decided to look a little further, and we found that there was a stippled autofluorescence there, which gave us a little bit of a tingle. Maybe there's something wrong here. The other eye is showing this atrophy. And so we did a fluorescein, and if it is a choroiditis, if there is some inflammatory lesion which is causing anything, there should be a lot more leakage. Here we are not having much leakage. You can see there are only few stippling. And when we went to the OCT, we looked at there was a little bit of fluid, and just on top here you can see a little bit of a choroid as well. Choroidal elevation here, and there is a bit of fluid here. So the other eye was normal. Further investigation showed that there was, the PET CT showed multiple Mets. Here was a case in which we picked up a cancer with a 6/9 vision with the subtlest of findings. We changed his life, patient treated, cancer under control. Now he is cancer free for 5 years. A stitch in time will basically save a life of the patient. You have the reverse situation also. Case 2, all that grows is not cancer. Look carefully, make a difference. This is a 48-year-old female who came to me in a stretcher. She was destined to die because she had breast cancer with multiple secondaries, with the brain, in the lung, in the eyes, and also in the spine. And we had an eye examination. That eye was only hand movements plus. The eye examination showed a large tumor with infiltration into the optic nerve. Actually, doing here, you can see here that the intense leakage. I showed you last time that our secondaries won't leak so much, right? So here we took a sample out and found out that this is Mycobacterium chiloni, and the whole thing was not it was tuberculosis, not cancer. Now we can see the treatment. The hand movements became 6/36. Now she's living and following up with me for 10 years now. So discover the power of an ophthalmologist in case of life and death.
Sir,
thank you very much.
This is a typical Malayali team. They are excellent storytellers, like Adur Gopalakrishnan. So,
all 9.
10 out of 10.
9.
For excellent storytelling.
Average is 9. So please come fast. We are running short of time. So now we go for the quiz round. And who is going to go for the quiz? And only one person to speak. You can prompt.
Hey, this is not correct. So this is bribing. It's very smart.
Sir, you are trying to bribe a Goa MLA. Not fair.
Already gone it. No.
So I'll click. Okay. Om Shum Sham Shim Shum. Minus nahi hai na?
Gopal, 1.
Okay. No problem.
So let's start the quiz. Ikeda. So we will be.
I'll be answering.
Let's start the. Rajesh, ready? Okay, start. 2 minutes.
Your time starts now. The first question is rate of intraocular gas expansion.
100%.
Okay. What's the answer?
B.
Okay. C is the correct answer, so it's wrong. The next question is all are true about conditions shown in the image except. So which is not correct? C. The answer is C. That's the correct answer. The next question is Vision ICL can currently be used to correct all refractive errors except.
C.
A is the correct answer. The recent FDA drug for the treatment of presbyopia is
A.
B is the correct answer. According to CCTS, high-risk grafts are defined as all except. So which one is not considered as high-risk graft?
D.
Your answer is?
D.
D is the correct answer. Next question is which one of the following is not a branch of ophthalmic division of trigeminal nerve?
D.
B?
D.
Okay. So D is the correct answer. Next question is which one of the following statements regarding Coats disease is true?
C.
C is the correct answer. Next question, which one of the following corneal dystrophies affects the corneal epithelium and basement membrane?
A.
A is absolutely correct answer. The next question is which one of the following is not a feature of lattice degeneration of the retina?
D.
D is the correct answer. And your last question, The patient in the picture received an injection of Botox.
Time is up.
B. Sorry? B. Boy. B is the correct answer. So you get marks for this. So the score is...
The final score is 7. 7 marks out of 10. Very well done. Amazing performance.
So science has given them 7 out of 10.
आने तो दो यार, स्क्रीन तो
So-
चेंज करो, स्क्रीन चेंज करो यार। पहले उसको दबा।
You have to try your luck now.
On 5. 11. Tie at second spot. So if there's a tie, it will be a split between the two teams.
So we have audience luck round, and I'll request Namrata Sharma is here, Honorary Secretary of AIOS,
Excellent medical video.
to please come and help the audience. Namrata, no bribery here. Please come
Come on this stage, come on.
Most hard-working lady I have seen in ophthalmology.
Our team yellow meanwhile gets ready.
Pick up one.
Team yellow, please get ready. Team yellow, please get ready.
Please come to the stage, Team Yellow. A warm welcome to you.
It's the same digit on the same digit twice. 88.
Anybody who is 88. So how much price, Harbansh? Rajesh?
5,000 cash.
Ek minute.
And they get a chance.
So another.
Sorry, this is also similar kind of a number. 5555.
Wow, क्या बात है?
Madam has diplopia.
Dr. Namrata madam, you know why you're getting everything twice?
Diplopia.
You are also the All India President twice. That's why.
Secretary twice.
Secretary
I have not
twice.
yet become.
There is no provision for president to become twice.
Okay, this is 159.
159. I think people are taking t-shirts and going away.
They are happy with the t-shirts. They don't want the prize. 119.
Yes, please come. Please come.
She's lucky.
Okay, we saw the first winner.
Come.
So ma'am, you get 5,000 bucks. How much? 5,000 bucks today.
And although these tickets
collected
should
from Honorary
be
Secretary.
put back into the hat, you can still get a mega prize once again if you are lucky. So you can win 2 prizes.
Yeah.
All ladies.
Play and pause.
Now after 5 years, sir, there are only women ophthalmologists.
Yes, ma'am. Please come.
Ekta Gupta.
So what will you do with 5,000 bucks? Shopping. She's go shopping in Mumbai. Thank you, Namrata.
So now Team Yellow, get ready for your video presentation.
So please start.
Okay, who's going to start? Red and yellow, rowdy fellow. You. Okay.
Team Yellow.
They are playing from there. And they are playing from there. Okay. My video. Yep.
So in video.
They have to play. It's.
So you already know the
First.
scores of rest of 3 teams.
Music is also there? Yeah. Okay. Yeah. Good afternoon, everyone. So I'm sure we all know that the best is always for the last. And I am going to show a video which has not been shown in AIOS. It has not been shown anywhere in public. But I'll be showing it to you proudly. So regular case of my penetrating keratoplasty by my fellow. And you can see that everything is going according not the exact plan. You can see that even after mannitol and Dimox, as they start doing the small area, you can see that an automatic lens expulsion is happening, and that's where the first hit is. You have some amount of vitreous which actually comes out. But then what happens? It is all new for my fellow. So she continues with the surgery. She finds that, oh, it's so easy. The lens has come and the vitreous has come. So it's very easy to do an ICCE. How many of you do an ICCE now? And there comes the second hit where we start doing the vitrectomy. So once the vitrectomy is done, the PK is starting to be done by the second suture. When they start putting, you can actually see that there is not much of tissue which is being allowed to put the suture. Yes, there comes the third hit, where it is not only the vitreous, and then the third hit comes where you also have the other tissues. Yes. So there's no audio coming. I told audio. So I just tell my fellow, don't worry, I'm also very scared. So then, as all of you know, for my wife, when there's some amount of fun, for my wife, I've actually done a heart rexis for her. I've done a heart cataract for her, and now I'm showing a heart retina for her. So yes, that's the amount of love I have. So yes, we all can see the suprachoroidal hemorrhage, which is the most dreadful and the one complication which no one wants to see, wants to have. And then my fellow shout, isn't there anyone? Yes, there I come. So then it's not only the 10-0 nylon. I then go ahead and take the 9-0 nylon, which gets cut. I take an 8-0 nylon. I'm sure many of them will be knowing, who have actually managed these cases. It is not so easy. As you keep suturing, the tissue keeps coming out, it keeps pushing, and you will not find any tissue which will be inside the eye. So some people actually say that use your thumb and press the tissue and don't allow it. Yes, but still it is not as simple as it sounds. So you can see that I keep on suturing. My only aim is make sure that the graft host junction is perfect and make sure there is not any iris tissue which is left outside. So yes, people, in the end I made sure that all the sutures are in place, and how it was to how it became. Thank you.
Well, this is one hell of a Talaiva video. So Talaiva, you get 10.
So you get 9 marks. Wonderful video. I must compliment you for the excellent video.
Not only wonderful, most violent video also.
Honestly speaking, I don't know anybody has seen such kind of video. Nobody should also see, because nobody wants to see this. Yeah, nobody wants to see.
I think it should be adulterated or something.
So, tap.
Yeah.
Okay. Medical case.
Yes, sir. Ready.
Ready?
Can I have the slides?
Slides on this side.
So this is a medical perspective of how we went ahead with implanting a glaucoma drainage implant in a patient with Axenfeld-Rieger syndrome. So this patient in 2014 was diagnosed with Axenfeld-Rieger syndrome without glaucoma and was told to come for annual review before she presented to us. In the 5 years she lost follow-up and developed glaucoma, and she started developing pregnancy as well, and that is when she presented to us. And the next 6 months in pregnancy, the vision started deteriorating, and second opinion she came with almost 1 eye 618 right eye, the other eye was almost 360 with tubular vision. She had all the features of Axenfeld-Rieger syndrome with mild craniofacial dysmorphism, and the patient had IOP of 38 and 32 with gestational diabetes, and she was on maximum tolerable medical therapy. The left eye was near GOA, the right eye was 0.9, and only the inferior ganglion cell was actually lost and only superior was present. In the other eye it was more like a tubular vision. So what we did, we wanted to save the right eye, we stopped her on prostaglandins, we asked for obstetrician fitness and went ahead with AGV implantation with tube in the sulcus owing to a weaker cornea of AR patients, and under subtenon's block the tube was actually placed. Trabeculectomy with mitomycin C is actually not teratogenic with MMC, and also trabeculectomy not in a young patient is advisable, and also tubes seem to be the better alternative for late postoperative endophthalmitis in mind, seeing it's one-eyed. So this eye the surgery was done, the tube was placed in the sulcus, and this is the video showing how the tube is placed and how the reservoir is, and this is the other eye. We did the other eye, a palliative trab was done after the pregnancy was completed, and you can see that the bleb actually fibro. So we took a right call for a seeing eye. So this is the follow-up. She's been there for 1.5 years to 2 years now. The IOPs are holding good. She's in low teens. So the medical perspective of this case is the RNFL is now seems to be better than before in the 2 years, and she presented to us in pregnancy. So these are the take-home points here. The RNFL has slightly improved, and this is the gonioscopic finding showing how the tube is also well placed and away from the cornea. We also diagnosed AR syndrome with the newly born son with whom she was pregnant, and we not ended, family screening was also done, and the boy is now currently under close follow-up. So the main points are it's a rare disease, pregnancy, glaucoma was refractory in pregnancy, it was a combination of paradoxical hormones, family screening was done, 2-year follow-up, 18 months to 2-year follow-up was done for this patient, and the medical thought process was obstetrician and neonatologist standby and subtenons anesthesia. We avoided group C drugs like bupivacaine in our anesthesia.
Conclude.
Group B drugs like lidocaine, general anesthesia was not done, and last but not least, this is the last slide, sir. Last but not least, we also prevented trabeculectomy with ARS because it fails MMC teratogenicity. It was avoided, and the patient on the table was put on left recubitant position to avoid a venocable compression, and the head was tilted right, and the surgery was done. Thank you.
Thank you. Marks.
Yeah, Mango, you tell me why I should consider this as a medical video.
Exactly. So you haven't caught. Everybody is...
No, you just tell me why, I'll give you the marks.
So this is...
because you use dorzolamide, it's a medical case.
More than the surgery, the thought process and the medical
Side
approach.
is your hand, marks.
Sorry, sir. 9.
The medical approach and the thought process, sir.
Well, good. Yes.
7. So please come for your luck.
Yes.
So judges, they do justice. They take care. You are presenting medical or surgical. So all the teams are now, happy.
So now we go for the last.
You see the last audience round carries cash prize of 60,000 bucks. So please hold on. So it has, आ रहा वो टीम का बात अलग टीम क्या अलग.
Why did you make us judges? We would have been better off as audience.
Judges also have a special gift for them, so they don't have to. They are lucky if they have been invited already.
So I will request. अभी quiz के बाद है. Quiz start. Ikeda.
Yes, so we have the last round of this session, which was the quiz. Can we have the quiz, please?
Nishant, only one person should answer.
Okay, time starts. Which is the most frequent traumatic retinal tear after blunt ocular injury?
Infratemporal dialysis.
That's the correct answer. Question 2. A young male presents with intense itching in both his eyes for past 6 months. The clinical picture is shown here. The most appropriate management for this case is... Which is the most appropriate management for this patient? C is the correct answer.
Very good.
Question 3. Natamycin may be effective in the treatment of all of the following infectious agents except... Against which one does natamycin... D is the correct answer, Muka. Answer question 4. All are true about the recently approved FDA drug Tepizza except which statement? Which is not true?
D.
Sorry, what is that?
D.
D?
D.
You mean D for darling. Okay.
Question 5. Management of the given situation in right eye are all except systemic evaluation, retina peripheral screening, intralenticular lens aspiration, or phaco with CTR with PCIOL. Look at the amount of subluxation.
B.
You mean B for ball?
B for ball, yes.
Okay.
B for ball is the wrong answer. Question 6. Which change would allow a hard contact lens to fit more tightly to a cornea?
Decreasing the base curve.
That is the correct answer. Question 7. Which of the following is not an example of aberrant regeneration?
C.
C is the correct answer again. Question 8. What is true about findings of rainbow trial for ROP? Which one is true? A is the correct answer again. Question 9. This lesion...
hydrosystoma.
Correct answer. And the last question. In which condition is laser photocoagulation not appropriate? A is the correct answer.
My God.
Very well done.
My God. What have you done here? What have you done today? All correct. So let's try luck now. Luck.
And the score is 8.
Luck.
8.
Tap. No, screen. Wait. So, before we declare the winners, let's hold on. Audience, can you please come and pick up now? You have done your job as a judge.
So the first prize by the audience is going to be 10,000.
Pick up.
Second prize 20,000, and the final winner will get 30,000.
Pick up one. Time is over. Pick up one.
Audience prize.
Audience prize number 1, 10,000 bucks. 81 is there. Number 81. One more. 192. Anybody 192?
81.
Come now, why not coming? So 10. Wait. Time. 10,000 bucks. Rajesh Sinha, treasurer. So now Rajesh Sinha is saying, why can't I take the money? Yes, Rajesh. All the judges, please. Yeah.
Sir, there's one more.
Yeah, I know. So one more by Amrish Darak. 191. Anybody 191? This is 20,000 rupees. 191. अरे पहन के आना पड़ेगा नहीं तुम देगा नहीं है राजेश सिन्हा देता नहीं राजेश सिन्हा is a tough man. We are a 20. So 191. What's your name?
Dr. Mirani.
So Rajesh Sinha hand over 20,000 rupees. Size. 20,000 rupees. Very lucky. More lucky than all the teams.
Thank you, sir.
What's your name?
Dr. Mirani.
Last. Hold your breath. Rajesh, last prize. What is the prize amount?
Prize amount is 30,000.
30,000 rupees. 30,000. And HMR will pick up.
152.
152. So she can't believe. She's rechecking. 30,000 rupees. So three cheers.
Shruti Nishant.
So judges also have a prize. So we have, because judges have done a lot of hard work, no tarikh pe tarikh, they are being given these prizes. So these prizes are again courtesy CIPLA. Nitish Pandey was generous. So these are, SSD drives, 1 terabyte each. And thank HMR. Rajesh. Thank you so much. Amrish Darak, thanks a lot. One more. Say thanks so much. Thank you everybody, and let's announce the team winners. Bolo. म्यूजिक भी जाना है डिस्प्ले मत कर
भैया
पहले runners up. There is a tie between blue and red. So blue and red, please come here. Blue and red. Blue and red teams. You can please, just stand here for a picture. So the prize money will be shared. Yeah, please. There is a tie. There's a tie. So you. There's a tie. Hold on. Judges. Decision. Okay. This is runners-up team. Okay, thank you. The winner is green. Green team is the winner. Come, green team. So let's cheer for green team. The Yossi team. आएगा. ये वही फोटो हो गया काफी है. This is Yossi team. Hold on. Yossi team, the future, Harbansh says future of Indian ophthalmology. So 3 cheers. So this was science plus luck. Now we are coming only science. Runners up. Green is the science winner. Runners up also. So Karan Bhatia, what do you think?
Go green.
So I feel extremely good and happy for the team.
Go green.
So
they get 1,20,000 in total.
Nitish Pandey, can you come for 1 minute? Bhake. So Nitish, this team has won 1,20,000.
Go green, it's raining money.
Can you please sit here for some time? Yeah. So he is the person who is giving them 1,20,000. So please say thank you.
Thank you so much.
Thank
you for the opportunity. We had a lot of fun.
Enjoy it totally.
अगली बार सर बड़ा हॉल और.
Next, last.
Science round.
Science round winner. Science round winner is blue team. Where is the blue team? Blue team, come here. So blue team is the science round winner. You are all scientific people, yaar. इतना बढ़िया video दिखाया आपने. So your feelings about the...
You get 60,000. Wow, it's amazing. To be here is to be, really great feeling.
So thank you very much. Enjoyed extremely. It's so much of fun. And then of course science and excellent team. I really like the yellow team. The effort they have taken to come with the yellow dress. Macha, you rock. Lungi dance.
Thanks a lot. We have exceeded time. We will not go further. But I want to, say thanks to Rahil because he has done the majority of the homework. All of us were just shouting, but he did he's a silent worker. Excellent. So I am going to give him one small token. Rahil, the small token for Rahil. So please clap for Rahil, all the teams. Rahil. Thank you, Rahil.
And for the two gentlemen who have actually scripted this program, Dr. Lalit Verma and Dr. Harbansh Lal, please put your hands together for the duo of Dr. Lalit Verma and Dr. Harbansh Lal. So thank you very much. Thank you very much for attending this session and making it really meaningful, very fruitful. Thank you. So we conclude the session now. Thank you very much.